Dr. Lois Ombajo, the infectious disease specialist, to help us understand a bit more about what's going on. But let's switch gears, Dr. and I trust you can hear me more clearly now and talk vaccines. We know that the Kenyan population now, only about 2% or so is vaccinated. But we're seeing some interesting findings from overseas. For example, America's CDC is now warning Americans who are fully vaccinated, you may need to mask up again. In the United Kingdom, we are hearing that some fully vaccinated individuals are falling ill and unfortunately having to be admitted as well. What do we now know about the kind of protection vaccines offer us?
Thanks, Wahiga. So in terms of what sort of protection vaccines offer, so from different studies, we know that vaccines prevent very severe disease and prevent mortality. So from the data that we have from studies, it says efficacy will be about 80%, which means there is significant protection against severe disease and against mortality. So far, we do not have very good data about how much it will protect from just getting the infection. We think that there's some protection, but how much that is still not clear to us. And the way I'd want us to think about vaccines is sort of like having an umbrella in the rain. It stops the rain from hitting you, but if you're in a large storm, then some droplets will still get to you. When we have very many cases or in a storm of COVID, so to speak, then even those who are vaccinated may still be at risk of getting some infection. Remembering that the protection is not 100%. So if it's not 100% and you have a lot of infection going around, then chances are that some of those who are vaccinated, a few of those who are vaccinated may get the disease, and a few of them may end up with severe disease. And indeed, even in the country, we've had people who are vaccinated who've had severe disease, and we've reported very few mortalities amongst people who've been vaccinated. If we go to the hospitals now, most of those who are admitted or who've gotten very severe disease have not received the vaccine. So vaccine will protect. It is not foolproof. It does not offer 100% protection. So even when vaccinated, when there's a large surge, there's still that risk that there may be some slip up, sort of like the umbrella in the storm. You may have some rain droplets on you. So even when there's a surge, there's a storm, we have to take extra precautions. And that's what you're seeing globally, with the US, for example, saying if you're indoors in a meeting, remember when you're indoors, ventilation is not that good. You may not have enough distancing between people. In such situations, it's still important to have your mask, even if you have been vaccinated.
Okay.
In our context, we know that most people have not been vaccinated, which means in the context of a storm or a surge of COVID, we may have a lot of people getting infection. So in that situation, indoors or outdoors, it's important that we keep our masks. It is important that we avoid gatherings. And I have to say that when we see a lot of cases, many of these cases come from situations where people are, hanging out together in close contact. So family meetings, funerals are really sort of breeding ground for a lot of COVID spread. And people really have to take caution when in such circumstances.
Okay. Dr. allow me to interrupt you. I don't have too much time and I do need to squeeze in two questions. One, I know we've got lots of vaccines coming in, AstraZeneca, Pfizer, Johnson & Johnson, and some may have their preferences on which one they want to take. Would you advise people to sort of prioritize one over the other? And the discussion about mixing and matching as well, whether it's effective or not. What's your response to that?
So one, I think the best vaccine is the vaccine available to you, closest to you. So if there's vaccine available, go for that one. Don't opt to wait for a few months to get the one that you prefer. The best vaccine will be the one closest to you. In terms of which one is most effective, for example, I think many studies show that as far as preventing severe disease and death, all the vaccines are effective. So get the vaccine that's available to you. Don't run to get this one and mix with another one, because we do not have a lot of good data around mixing. There's been some data that suggested that those who got AstraZeneca as their first dose and got Pfizer as their second dose had good protection, but we do not have any data on mixing of other vaccines. So because we'll have sufficient doses of each of those vaccines, people can get the same vaccine, 2 doses of the same vaccine without mixing. So at this point, the advice would be get the vaccine that's available to you, get 2 doses of the same vaccine as appropriate. We are not in a situation yet where we need to mix vaccines.
Okay.
The other one is that if if you've already received 2 doses, then do not run for the 3rd one. We still do not have data yet on how effective or useful a 3rd one will be. So allow those who haven't gotten the vaccine to get theirs instead of, taking up all of them for just a few people.
Okay. It sounds like you're discouraging Kenyans from going for that booster shot. We had a vaccine manufacturer recently say it may be necessary after 4 to 6 months to get a 3rd shot. It sounds like you don't fully agree with that. And even as you respond to that, how many counties do you think the Delta variant is now domiciled or moving through at this time? Do you have a number?
So I do not have a number to that last question, but what we know is that earlier in March to April and most of last month, when there was a big surge in the western parts of the country, most of what was circulating there was the Delta variant. It's very likely that is what is circulating in most of the country. And indeed, globally, we're seeing the Delta variant as the most prevalent variant everywhere. In terms of going for for a booster, we do not have enough data to support the need for a booster. Remember, the people who've had the vaccine longest have probably just had it for about a year now. And some of the data that we have suggests that the immune response is still showing, fairly good immunity even up to a year. So at this point, even though we think that, like with many viral infections, there may be need for a booster, we do not have enough data to support a booster. So we will not be encouraging people to go for the 3rd dose yet. Remember, though, that this is a new disease which we are still learning about. We're still learning about these vaccines.
Okay.
I think I was probably one of the first people to get the vaccine, but it's only been since March. So we do not have enough time and experience to know how long the immunity will actually last. So we are learning, and as we learn more and more, we'll be updating some of these advisories with time.
Dr. Mbajo, thanks so much for your time. I know we may need to have another session at a different time to answer some of the questions our viewers may have, but thanks for making what you know at this moment clear to those who are watching the broadcast this evening. Dr. Lois Mbajo, Head of Infectious Diseases at the University of Nairobi, based at the Kenyatta National Hospital.